tuned engine, requiring constant energy input to function. Common symptoms include extreme thirst and dry mouth.
You may also urinate frequently, as your kidneys try to flush out the excess sugar. If left untreated, high blood sugar damages blood vessels and nerves over time. If a wound shows signs of increasing redness and pus, it may be infected. However, diet plays the biggest role. Reducing sugar and regular checkups with your doctor are crucial to monitor your eyes.
Live the life you deserve, full of energy and positivity. Find the balance that keeps your inner health glowing.
Prevention is better than cure. Eat healthy, stay active, and avoid sugary drinks. Diabetes is one of the most common health conditions in the world. It is essentially a problem with how your body handles energy.
The human body is like a finely tuned engine, requiring constant energy input to function.
When you eat carbohydrates like bread, rice, or sweets, your body breaks them down into glucose.
This glucose enters your bloodstream, raising your blood sugar levels. But it can't just power your cells on its own.
Think of your body cells as locked houses. Glucose is knocking on the door, but it cannot get in without a key.
That key is called insulin. It is produced by an organ located behind your stomach called the pancreas.
When the pancreas detects sugar in your blood, it releases insulin into the bloodstream. Insulin travels to the cells and attaches to the outer wall, unlocking the door.
Once unlocked, glucose enters the cell to be used as energy. This lowers the sugar level in your blood.
In a healthy body, this system works perfectly to keep blood sugar levels balanced. But in diabetes, this system breaks down. Either you don't have the key, or the lock is broken. Let's start with type 1 diabetes. This is an autoimmune disease. Here, the body's own immune system mistakenly attacks the insulin-producing cells in the pancreas. As a result, the pancreas produces little to no insulin. The keys are missing. Now, let's look at type 2 diabetes. This is the most common form. In type 2, the pancreas makes insulin, but the cells stop responding to it. We call this insulin resistance. It's like having a key, but the lock is jammed. The glucose cannot get in.
The pancreas works harder to make more insulin to overcome this resistance, but eventually it wears out.
In both types, the result is the same. Glucose builds up in the blood instead of fueling the cells.
This makes the blood thick and syrupy, which is dangerous for your body. Common symptoms include extreme thirst and dry mouth.
You may also urinate frequently, as your kidneys try to flush out the excess sugar.
Since sugar isn't reaching your cells, you feel constantly hungry and extremely tired.
If left untreated, high blood sugar damages blood vessels and nerves over time.
It can damage the eyes, leading to diabetic retinopathy or even blindness. It overworks the kidneys, potentially leading to kidney failure.
It destroys nerves, especially in the feet, causing numbness or tingling. This is called neuropathy, and it significantly increases the risk of heart attack and stroke.
If a wound shows signs of increasing redness and pus, it may be infected. Seek treatment immediately. Doctors diagnose diabetes by testing your blood sugar levels with a simple blood test. The HbA1c test measures your average blood sugar over the past 3 months.
For type 1, lifelong insulin injections are necessary to replace what the body cannot make.
For type 2, doctors often prescribe oral medications to help the body use insulin better. However, diet plays the biggest role. Reducing sugar and refined carbs is essential. Choose complex carbohydrates like whole grains that release energy slowly. Exercise is a powerful medicine. Active muscles can absorb glucose even without much insulin. Losing excess weight can drastically improve insulin sensitivity, sometimes even reversing type 2 diabetes.
Managing stress and getting enough sleep also helps regulate blood sugar hormones.
Before developing type 2, many people have pre-diabetes. This is your warning sign to change your lifestyle.
Be careful of hypoglycemia, or very low blood sugar, which can happen if you take too much medication. Drinking plenty of water helps your kidneys flush out excess sugar.
Eating fiber-rich foods creates a mesh in your gut that slows down sugar absorption.
Regular checkups with your doctor are crucial to monitor your eyes, feet, and kidneys.
Live the life you deserve, full of energy and positivity. Find the balance that keeps your inner health glowing.
Prevention is better than cure. Eat healthy, stay active, and avoid sugary drinks. Myth: only eating sugar causes diabetes. Fact: genetics, obesity, and lifestyle all play a part.
If you found this video helpful, please like and share it to raise awareness.